Hi, my name is Dr. Pedram Bral. I am a board-certified OBGYN, and I've been practicing in Maimonides Medical Center over a decade. I went to medical school in downstate in Brooklyn, and after that I got accepted in Maimonides for my residency. I really like the fact that it's a community hospital, not a small city hospital or big university hospital. You had more hands-on, more patient contact. The diversity in Maimonides was, to me, was an amazing thing as far as it goes with education. And you learn not only medicine and residency and get trained in your field, you also learn a lot about different cultures and customs, which was also amazing to me. I chose obstetrics and gynecology just because I think it was one of the few specialties out there that encompasses both medicine and surgery. I always liked surgery, but I always thought that surgery doesn't have as much of a follow-up and patient continuity care that medicine would. And doing OBGYN, you pretty much follow somebody throughout their entire life, from being young to going through childbirth, and after that you go through having, to menopause and, delivering their children, and be with them the entire time, which to me was amazing. Minimally invasive surgeries became my special interest about maybe 8 years ago, and I started developing more. And minimally invasive surgery is doing the same procedures we used to do with big open cuts, either vertical or transverse bikini, as they call it, into little keyhole incisions that you get a 5 mm incision, maybe 2 or 3 5 mm incisions, and you can do the entire procedure that you used to do with an open procedure with those little incisions. Obviously, the bleeding is less, the pain is less, patient recovery is much, much faster. Patients go home, in a matter of hours sometimes. You can do a hysterectomy, patient goes home in 6 hours, where they used to stay maybe 4 days or 5 days sometimes. Patients go home on Motrin, where they used to go home on Vicodin and all these other narcotics. So that, again, is something that I started developing an interest, and I kept pushing myself, and I didn't really give up because it wasn't something that people used to do. And now, thank God, more and more people are getting to it, and I think it's an amazing revolution in OBGYN. I think the way, when a patient comes to me, the philosophy in the office is that, first of all, I handpick the nurse and the secretary, whoever greets them. I think it's very important, the first person that you meet in the office, especially if you're going to a new doctor, for that person to really put a face to the office. And that's, to me, has been very important from the beginning. And I think when it comes to deciding, the patient deciding if they have to go for a procedure, they need to be completely knowledgeable, as to my best ability, to try to make them understand about every possible procedure that is available to them, and then for them to be able to make a sound decision, a very educated decision. True, many of them can come up with the decision on their own. Sometimes it's very difficult to come up with the decisions, even though you have most of the facts or all the facts that I can possibly give them. And it comes to a point that we have to sort of sit down with the patient and try to eliminate certain procedures, and try to pick the one that is going to be the best one left at the end. And I think most of the time that's the way it happens. There are few patients that come in from other physicians that already have been spoken to, and they already have an idea of what they want done. So even then, I think they should hear from what I believe is the right choice, and what I know about the things that are around for them to make the right decision. I think the biggest trend now in the surgical field, OB/GYN, especially the GYN part, which I'm more involved, is the robotic surgeries. About 5 years ago, we started doing robotic surgeries in Maimonides. FDA approved robotic surgery for gynecology in 2005. And we pretty much started around the same time FDA got, FDA approved GYN surgeries. Since then, I've done many surgeries, myomectomies, hysterectomies, sacrocolpopexies. These are for removing benign tumors, and people that have prolapsed uterus or bladder to fix them robotically. Again, the benefit of doing it robotically versus open or even vaginal is that I believe the recovery is much faster, the bleeding is much less, and the visualization is much better for the surgeon. So I think the biggest breakthrough has been in the past few years the robotic surgery, and I think the biggest breakthroughs in the next few years and possibly within the next decade will continue to be the new development in the robotic surgery. As we speak, they're coming up with a one-port robotic surgery, which is in the midst of being developed. And I think that's going to be the next wave in GYN surgery. The key achievement in my career, and I think I sort of alluded to it before, I think every procedure that I do, every surgery that I do, that I see the result after a day or two, to me is a huge achievement. I mentioned it before, after a decade of doing these procedures, every procedure that I do and I see the patient walks home in 6 hours, amazes me, still amazes me. And when I speak to my friends, I still say, I don't know how this has happened. We used to have patients groaning in bed for 2 days, trying to get them out to walk. Now they come to the office asking, I want to have this procedure. I want to know if I can go home the same day. And the majority do go home the same day. Some stay overnight. I think one example I can give you is the procedure that I did yesterday on a 79-year-old woman who came in with complete procedentia, which means her bladder, her uterus, and the rectum were all hanging out for years. She had a open heart surgery last year. She was suffering from this. She is back, she's walking, but she's extremely uncomfortable. And we did a robotic hysterectomy, and we lifted her bladder, her rectum, and her cervix. Fixed the neck of the bladder so she's not having any more incontinence, and she's going home this morning. And this is a 79-year-old woman that would have either been refused a care maybe a few years ago, maybe still today, that is walking home after a day of major surgery, which I've done many of them. I still am amazed by it.